Stomatitis is an inflammatory condition of the oral mucosa, and its pathophysiology begins when the delicate lining of the mouth is exposed to injury or irritants such as infections, trauma, nutritional deficiencies, or chemotherapy and radiation therapy. These factors directly damage the epithelial cells, weakening the natural barrier that normally protects the oral cavity. Once this barrier is disrupted, inflammatory mediators like cytokines and prostaglandins are released, which trigger an influx of immune cells to the affected site. This response causes redness, swelling, and pain, creating the first visible signs of stomatitis. As inflammation continues, the mucosal surface begins to break down, leading to the formation of shallow or deep ulcers. These ulcers are highly painful because they expose nerve endings and make daily functions like eating, drinking, and speaking very difficult. The open lesions also become an easy entry point for bacteria or fungi, resulting in secondary infections that worsen the condition. If the body's immune system is compromised or nutritional support is poor, healing is delayed and the ulcers can persist for longer periods. Over time, chronic inflammation and recurrent ulceration can significantly affect a patient's overall well-being, leading to weight loss, dehydration, and decreased quality of life. This entire sequence of events highlights how a simple injury or irritation can progress into a complex and painful condition if not properly managed.